Will HRT automatically give me breast cancer? Are you a woman that is afraid of hormone replacement therapy because all of the talk that it increases your risk of breast cancer? Well, today we're going to dive into a topic that's very controversial: hormone replacement therapy, or HRT, and its supposed link to breast cancer. If you've ever wondered whether taking HRT automatically means you'll get breast cancer, keep watching this video and stick around to the end to gain a few extra pluses to doing HRT as a woman. Today, I'm going to be going over the controversial topic that HRT can cause breast cancer in women, and I'll be answering many different questions related to this matter. I'll be talking about how HRT works, what it does inside of your body, what results you can expect, the most common side effects of HRT, and if you should actually fear breast cancer while being on HRT. The chapters of this video are in the description in case you wanted to skip to anything. Don't forget to like and subscribe for more content like this, and let me know in the comments, what's your opinion of HRT? Would you ever get it? Why or why not? I'd love to hear your experiences and your thoughts. So how does HRT for women work? HRT stands for Hormone Replacement Therapy. It's a medical treatment that involves supplementing or replacing hormones in the body, typically estrogen and progesterone, or progestin as a synthetic form of progesterone, as well as testosterone. HRT is commonly used to address hormonal imbalances or deficiencies, particularly in women during menopause or those who have had their ovaries or uterus surgically removed. There are different types of HRT, the first one being estrogen therapy. This involves taking estrogen alone, usually prescribed for women who have had a hysterectomy or surgical removal of the uterus. Estrogen therapy can help relieve menopausal symptoms such as hot flashes, vaginal dryness, and bone loss. The second one is estrogen plus progestin therapy, or EPT. This combines estrogen with progestin, a synthetic form of progesterone. EPT is typically prescribed for women who have not had a hysterectomy, as adding progestin helps protect the lining of the uterus, or the endometrium, and reduces the risk of endometrial cancer. The third is testosterone. Testosterone is a hormone that can help in metabolism, sexual libido, as well as reduce aging. HRT can be administered in various forms, including oral tablets, skin patches, topical creams or gels, vaginal rings, injections, or pellets. The choice of HRT formulation and route of administration depends on individual factors such as symptoms, medical history, and personal preferences. So what kind of results can you expect from being on HRT? Some of the common results and benefits associated with HRT are relief from menopausal symptoms. HRT is highly effective in reducing or eliminating menopausal symptoms such as hot flashes, night sweats, vaginal dryness, itching, and discomfort during intercourse. It can also improve mood swings, irritability, and sleep disturbances commonly experienced during menopause. Estrogen plays a crucial role in maintaining bone density and preventing bone loss. HRT can help reduce the risk of osteoporosis and fractures by maintaining bone strength and density. HRT can also help alleviate vaginal dryness, thinning of vaginal tissues, and vaginal discomfort, making sexual intercourse more comfortable and enjoyable. It can also reduce the risk of vaginal infections and urinary tract infections. Some studies also suggest that HRT may have cardiovascular benefits, such as lowering the risk of heart disease and the risk of stroke, especially when started early in menopause. Estrogen can contribute to healthier skin and hair by improving hydration, elasticity, and thickness. Some individuals may notice improvements in skin texture, reduced wrinkles, and stronger, shinier hair with HRT. So what are the most common side effects of HRT? Well, like any medical treatment, there are potential side effects. Some women may experience breast tenderness or swelling when they start HRT. This side effect usually subsides over time as the body adjusts to the hormone therapy. For women taking estrogen plus progestin therapy, there can be irregular bleeding or spotting, especially during the first few months of treatment. This is more common with continuous combined HRT, where progestin is taken every day along with estrogen, or with pellet therapies, and the medication are given every single day. There is some possibility of nausea or digestive discomfort, particularly during the initial stages of taking HRT. Taking the medication with food or at bedtime can help alleviate this side effect. Headaches, including migraines, are also a possible side effect. These headaches may occur more frequently in some individuals, especially during the first few weeks. However, as the hormones balance in the body, most of these side effects go away. HRT can also cause some fluid retention, leading to bloating, although this side effect is very temporary and resolves as the body adjusts. At the beginning, some women may also experience some changes in mood, including mood swings, irritability, emotional sensitivity, and increased sexual libido. These mood changes are typically mild and improved with time, and fatigue or tiredness is also another common side effect of HRT during the initial treatment. However, continued HRT will improve fatigue and improve tiredness, leading to more energy, more blood flow, more clarity of thoughts. As the body adapts to these hormonal fluctuations, it's going to go through different changes. We want to turn back the clock and help patients who are older get back to how they were feeling in their 20s and 30s. So a lot of these side effects are usually mild and transient on their way to feeling much, much better. During treatment, you want to make sure you're maintaining adequate hydration, doing stretching exercises, and also taking adequate potassium to prevent any leg cramping or muscle spasms. It's always crucial to discuss any concerns or side effects with your healthcare provider, who can provide guidance, adjust the treatment if necessary, and monitor for any potential complications. So to our question, should women fear breast cancer if they're on HRT? The relationship between HRT and breast cancer risk has been a topic of extensive research and discussion among healthcare professionals and women considering or using HRT for decades. Here are some of the key points to consider regarding breast cancer risk and HRT. Studies have shown that certain types of HRT, particularly estrogen-progestin combinations taken for menopausal symptom relief, can slightly increase the risk of breast cancer. However, this increased risk is generally seen with long-term use of HRT, as well as high-dose use of HRT, typically seen after several years to decades of continuous treatment. The type of HRT and duration can influence breast cancer risk exponentially. Estrogen plus progestin therapy is associated with a higher risk compared to estrogen-only therapy. This is why in most females, we only need to treat them with testosterone and estrogen for 8 out of 10 females to get their hormones balanced. Sometimes, and very few times, do people also need progestin. The age at which HRT is initiated and duration can also impact breast cancer. Starting HRT closer to menopause and using it for a shorter duration poses a lower risk compared to those starting at an older age or using it for many years. Breast cancer risk is also influenced by various individual factors as well. Medical history, family history of breast cancer, genetic factors, lifestyle factors such as alcohol, smoking, physical activity, and overall health status. The more unhealthy you are and the more unhealthy habits you are, the higher your risk of cancer. All this being said, no matter what your opinion on whether HRT is directly linked to causing breast cancer in women on HRT, all women should be undergoing regular breast cancer screening, including mammograms and clinical breast exams as recommended by their healthcare provider. Early detection and timely intervention can significantly improve breast cancer outcomes. And now for the bonus. HRT has been shown that it may also have positive effects on mood, cognitive function, and overall well-being. It can help reduce feelings of anxiety, depression, and cognitive decline associated with hormonal changes during menopause. The most common thing we see is middle-aged and menopausal females coming to their primary care doctor and being told that they're going through a midlife crisis, or being told that their children are causing them stress and anxiety, and that's why they have to be on an anti-anxiety or depression medication. 9 times out of 10, it is not an issue with anxiety or depression. However, it is an issue with their hormones. It's important to always check the hormones before taking any anti-anxiety or anti-depression medications, as the harm is way more than the benefit. It's also important to also weigh the potential benefits of HRT, such as relief from these menopausal symptoms, improved quality of life, improved bone health, and decreased risk of anxiety, depression, and other mental health issues. For some women, the benefits of HRT greatly outweigh the risks, especially when used for a short duration at a lowest effective dose. Even those patients that need it for a long time, as long as they're being treated with the lowest effective dose, there is no increased risk of cancers. So there you have it, a brief overview of the link between HRT and breast cancer. If you still have any questions or concerns, comment them below. I'd be happy to answer them. And if you're interested in exploring HRT for yourself, click the link in the description to book a consultation with one of our experts. As always, don't forget to like and subscribe, and I'll see you next time.